I'm Dr. Rachna Kucheria, a family physician at DCare. I'm here to talk about the season changing, and with it, we're getting colds, coughs, and fevers. I'd like to let you know a little bit from my experience. So the first thing is to not take every cold and fever in an offhanded manner. Let me start with fever. Because there is a lot of that's already restarted, I would say. The dengue fever season is on the decline or almost over. And now we're seeing more of the fevers associated with coughs and colds. A couple of things that are very important. One, measure the fevers. If you're having a fever which feels a little more than just a low-grade fever, do measure it with a thermometer so that we can have those readings when we see you. And the degree of fever, the frequency of fever, other problems associated with the fever, you need to see a family physician or a GP to be able to make the correct diagnosis, to be able to ensure that this fever is not something more serious than just what we call a mild viral fever. So do come in, see your family physician, your GP, and let them make the determination if the fever's gone on, let's say, more than 48 hours. And it would certainly help if you brought in your temperature reading with you. In the case of coughs and colds, again, the same thing goes for cough. If your cough has lasted, I would say, more than 3 days, do come in and see your doctor. It could be an infection, it could be what we call a bronchospasm, and the correct diagnosis and medication needs to be started early so that it doesn't linger. As we all know, the pollution and the environment don't help. So if you want your coughs to be taken care of correctly and on time, do come and get them seen. How to avoid a cold or a cough? Well, the most prudent advice is if somebody around you is coughing or having a cold, sneezing visibly, stay at least 3 feet away from them. Make sure you're washing your hands frequently, as well as the person who's sick is. If it's somebody in the office, maybe you might suggest that they go home for the day. And then the other usual pieces of advice that we give you: eat healthy, drink lots of fluid, make sure you've included vitamin C in your diet, make sure you're exercising. I hope that helps, and if you need to see your doctor, do come in right away.